Good morning to you all. My name is Balajata, focal point for neglected tropical diseases at the Ministry of Health. I will moderate this session today, and I'll also give a brief introduction of why we are here today. The Ministry of Health, through the Epidemiology and Disease Control Unit, where we have the focal point for neglected tropical diseases, is embarking on a countrywide mass drug administration to treat young children and at-risk adults of worms, usually caused by Schistosomiasis. Many of us will have seen people passing blood in urine, and this is what is Schistosomiasis. So today we are here to do a press briefing to discuss, to enlighten the population about what activities we've put in place for this very important mass drug administration. Here we are joined by the staff of the Epidemiology and Disease Control Unit, with our boss, Sanasamu here, the program coordinator for the Epidemiology and Disease Control Unit, ably assisted by Amadou Rijalo, who is also going to stand in for the Director of Health Services, who is unavoidably absent. We also have our principal technical and financial partners, the World Health Organization, and we also have the Africa CDC here with us, and we have the Director of National Public Health Laboratories, we have the ICT unit of the Ministry of Health, and all other stakeholders and partners, the media. We welcome you to this very important meeting. From Friday the 17th to Sunday the 26th of May, we will be embarking on a mass drug administration in 27 districts across the country in 6 of the 7 health regions. That is Western Health Region 2, Lower River Region, Central River Region, URR, North Bank East, and North Bank West. This mass drug administration is targeting preschool age children, which is children that are in preschools, that is from age 2 to 4 years, 11 months, that's below 5 years. And then we also have the school age children, we call them SAG, that is those that are between the ages of 5 and 14. And then we'll also be treating at-risk adults. When we talk about at-risk adults, we're talking about people that come in contact with freshwater bodies that bore these vectors that cause Schistosomiasis. This include farmers, include fishermen, it includes all other trades that come into contact with fresh waters, including children that will always swim in freshwater bodies and ponds across the country. You know, some of us that come from the provinces like Sierra and URR, we see when students close from school, before going home, they pass through ponds to swim and the like, and this is where they pick this very important vector that causes Schistosomiasis. And one of the key signs is blood in urine. The World Health Organization has been instrumental in making this campaign a possibility, because we have struggled to get funds and resources to ensure that these people are treated to prevent them from having Schistosomiasis. So the WHO had to come to our aid to support and canvass for medicines. The medicines are donated by the Mexican Donation Program through the WHO, and WHO also, from the Expanded Special Project on the Elimination of NTDs called ESPEN, is a WHO project that is targeting or dealing with NTDs specifically, and they are directly under the WHO, and they mobilize these resources through the WHO country office and send to the Ministry of Health to support in providing these medications to the people that need it. The success of this MD relies on collective efforts of various stakeholders, the media inclusive, and I would like to extend my gratitude to the Ministry of Health, the local government authorities, community leaders, health workers, and the international partners like WHO and the Africa CDC that are here to support us both technically and financially. And your collaboration and dedication are vital to ensuring that we reach every eligible individual with the necessary treatment. And this year, our target population is about 600,000 individuals that we want to treat with this Praziquantel. Praziquantel is the drug of choice to treat Schistosomiasis, both if individual has it as a disease or a condition, and if you want to prevent the disease. And then our strategy includes setting up distribution points in schools, community centers, and other easily accessible locations to ensure broad coverage. We are going to target schools. We'll be going to schools because this is where we have the school age children and the preschool age children. So we will target schools so that we will be able to get a lot of eligible individuals who will take these medications. So we'll also be at community bantabas and key places in the communities where people can come together to come and get these medications. And trained health workers will administer the medication and provide clear information on other important and benefits, ensuring safety and well-being of the recipients. So this is why, as a policy in the country, whoever is issued medications, you must be a trained health worker. And this particular campaign is not an exception. We have our trained healthcare workers across the country that will be administering these medications to the populace so that they comply with the rules and regulations of the administration of drugs, and so they provide the required information to the population in case because there is no medicine that will not go without adverse effects. Some people's morphologies are different. I may take the drugs and I don't have any adverse effects, but someone may take it and then will see some adverse effects. So that's why we ensure that people get the required information. So in conclusion, I would like to thank WHO, the Mark Foundation, ESPN, Africa CDC, the Ministry of Health and its partners, other partners, for the support and commitment to ensuring that this event takes place.
Good morning, colleagues. Thank you so much for the privilege to be here and also for the great work we are all doing together. I want to thank the Epidemiology and Disease Control program for this very wonderful activity they're organizing. I thank the program coordinator for the teamwork and also the partners we have, the WHO, for always being there to bring the state, the country to this level in terms of ensuring that the incidence and prevalence of the neglected tropical disease, particularly the schistosomiasis and also the STH, soil-transmitted helminthiasis. I actually understand that we have made a lot of progress in STH reduction and the reduction of the other NTDs. So, as Africa CDC, we are very much concerned about working together to make sure that NTDs are reduced, eliminated possibly, because these diseases are preventable, even though they are termed neglected. They are not neglected because they are not important, but they are neglected because we ourselves need to do everything we can to solve the problem that affect us. So I enjoin the media to continue to work with us in creating the awareness, because the people need to understand that the soil-transmitted helminthiasis, the schistosomiasis burden is increasing, and the health effects are really daring to the country. And by taking these medication, these drugs, especially the Praziquantel, which is in use, we are going to reduce the burden of these NTDs in the country. We have also taken notes to be sure that the teams are working hard to make sure that pharmacovigilance in the sense of monitoring the intake of these drugs to understand the safety of these drugs among the population. So we understand also that these drugs are taken and may have one or two side effects that do not constitute any health risk to the populace, because the benefits actually outweigh whatever risk we are talking about. So we don't want to have any impression of the drug being taken and the people are saying that it has negative effects. I want the media to join us to make this campaign very loud, that these drugs are safe. These drugs have the capacity to reduce the burden of NTDs in our communities. This drug has the capacity of making our children, those population at risk, to walk healthier than they wouldn't have done. And this drug has the capacity of freeing our communities from the very negative burden of the neglected tropical disease, particularly schistosomiasis and the soil-transmitted helminthiasis. Thank you so much, and we are going to make it together.
Thank you very much, Pius. And one key takeaway message that we need to remember is neglected tropical diseases are usually termed as diseases of poverty because they affect the most vulnerable and the poor communities. This is why they are found within those areas where access to healthcare services is limited. If you look at the global burden of NTDs, we have over 250 million people that are affected worldwide by schistosomiasis alone. And out of that, 60% of that global burden is on the African continent. And where in the African continent, in the communities where access to healthcare services is limited. So doing this is part of the global targets for the NTD roadmap 2021-2030, global NTD roadmap, which indicates that at least every country, or at least 50% of countries with high burden of schistosomiasis should be able to eliminate or eradicate one NTD before 2030, schistosomiasis included. And part of our targets as a country is we want to eliminate schistosomiasis by 2030 in line with the global target. And this is one way that we can be able to achieve that target. So on that note, I will invite Dr. Ifani from the World Health Organization to come and deliver his statement. Fine.
Yes, good morning, colleagues. The Minister for Health, ably represented by EDC Program Coordinator, Amadou Wuri Diallo, other directors from Ministry of Health here present, partners, Africa CDC Program Coordinator, and other partners present, the media, ladies and gentlemen. I bring you warm regards from WHO Country Representative, Dr. Jane Minor, who is unavoidably absent due to other engagements this morning. The WHO, from inception, has supported this mass drug administration in the country. The last event was in 2021, but now, this year, we have then gathered some funding and the medicines for this program. It will happen between 17th to 26th of May, 2024, in all the 6 regions and 27 districts in the Gambia. This campaign is targeting preschool age children from 2 years to 4 years, school age children from 5 to 14 years, and also at-risk adults. And from the documents available to us, we are targeting around 600,000 personnel in this campaign. The goal of this MDA is to reduce the prevalence of schistosomiasis and move forward towards the elimination of the disease as a public health problem. This is in line with Global NTD Roadmap 2021 to 2030. WHO has played a critical role in facilitating this campaign, thanks to MEC Praziquantel donation program, who provided the medicines for us to distribute. This donation was possible due to the support from Expanded Special Program for Elimination of NTDs, ESPEN, at WHO Afro and WHO Country Office in Gambia. WHO has also provided some funding to ensure that this MDA is conducted successfully in the Gambia. The importance of conducting this campaign cannot be overemphasized. Schistosomiasis remains a significant health challenge, particularly affecting children and adults who are at risk due to their environment and occupation. By administering these treatments, we want to protect our most vulnerable populations, prevent the spread of the disease, and ultimately eliminate its presence in our communities. Our approach involves comprehensive planning and coordination with the Ministry of Health, the local government, community leaders, and health workers. The medication will be distributed at schools, community centers, and other accessible locations to ensure that every eligible individual will receive the treatment.
So we are here with Bala to take us through some of the the happenings of today's press briefing. Now, Mr. Bala, we understand that the the schistosomiasis is not something that is common to people, even though it's affecting the environment, it's affecting the society. But then we understand that not many people know about the disease. Can you take us through the some of the issues surrounding the the disease, and then the symptoms, the signs and symptoms, and then how do we recognize them?
Thank you very much. To clarify things, schistosomiasis is a very common disease in the country. Since the first ever study that was done in this country to look at schistosomiasis was done in 1985 by the late Dr. Ablaijak when he was doing his PhD research, and it indicated that we have Gambia is a high endemic country for schistosomiasis. And since then, like the words neglected talks about, schistosomiasis is part of the list of neglected tropical diseases by the World Health Organization. Now we have 21 neglected tropical diseases across in the world, and in the Gambia we have about 15 neglected tropical diseases, including schistosomiasis. And from 1985 to 2015, not much work had been done to schistosomiasis in this country. But building on what Dr. Jack did in 1985, we were able to use his work as literature to come up with a concept note to remap the country to assess the endemicity level of this country. And then we realized that on average, the Gambia had like 10.4% endemicity, meaning out of every 100 Gambians, 10 had schistosomiasis in this country. And that's what we were able to depict in the 2015 mapping. But if you go down to the regional level and even to district level, CRR, we had the highest burden of schistosomiasis in the Gambia for CRR, which was about 17.9%, and then URR had 14.3% or so. And then we had other regions and districts that are highly endemic. And this is what formed the basis for mass stroke administration, because we've seen that, for example, if you go to CRR and URR, you will see people coming down with the disease. Even in Western too, where places like Combo East, Combo Central, and Fonyi Jarol, those are also one of our high burden districts within the Combos or the Fonyis. So with schistosomiasis, the main signs and symptoms, for someone to easily see it is either you tell the individual that you have, the individual will tell you I have pain whilst urinating, or they will tell you I'm seeing blood in my urine. So those are the key signs and symptoms that we look for to suspect that it's schistosomiasis. And then we do a urine test. It's just a mere, they take urine and then they use a urine dipstick, or they do microscopy to be able to determine whether it's schistosomiasis or not. So testing for it is not something that is tedious, it's very quick. You can test within a short period, you know that it's schistosomiasis or not.
So now, you are going on to a campaign. Now, which areas are you targeting for this campaign? And what is the reason for, choosing those areas?
Okay, we are targeting 27 districts in this country. And the reason for choosing those districts for the campaign is when we did our mapping in 2015, in 2019, we reanalyzed the data using population projection because we were supposed to do another mapping, but because of the unavailability of resources, we couldn't do the mapping. So what we do is you reassess, analyze your data using population projections, and you calculate to get the endemicity moving forward. Maybe for the next 5-6 years, you can always project your endemic population. So when we analyze the data, we also try to look at the 3 levels of endemicity. You have low, moderate, and high. And according to WHO guidelines, if you don't have adequate resources, you need to do mass stock administration in moderate and high endemic districts. And then the low endemic districts, you can leave those ones for treatment or for routine treatment purposes. So this is what has formed the basis for this mass stock administration. It's data-driven mass stock administration. We are not just going into those districts blindly. We are going because the data is saying that we need to treat those people. That means those districts have an endemicity level of above 10%. So once the district has an endemicity level of above 10%, you need to treat. So all those districts that are below 10%, we can leave those ones for routine exercises. And then those districts that we are going into, like in the Western 2 Health region, we are going into Kombo Central, Kombo East, and Fonyi Jarol. And when we go to LRR, we are going Kiang Central, Jara West, and Jara Central. And then when you go to North Bank West, we are doing Lower Nyomi, Upper Nyomi, and Jokadu. You go to North Bank East, we have Central Badibu, Upper Badibu, and Sabak Sanjal. Then in CRR, we are going to all the districts in CRR apart from Janjambure and Upper Salum. It's only Upper Salum and Janjambure that we are not doing mass stock administration in CRR. This does not mean that they do not have the disease in CRR, but we do not have the evidence that they require mass stock administration, because when we were doing the mapping, due to sampling error, we missed those 2 districts. They were never mapped. So we cannot do mass stock administration blindly in those districts. So thank God we are going to map them in October this year, inshallah. We will map them and then we will do mass stock administration. The next subsequent mass stock administrations, we will be able to cover them if they are endemic or either high or moderate. And then for URR also, we are going into all the districts in URR.
We wish you a successful campaign, and then thank you so much for talking to us.
Thank you.